Hi everyone, my name is Kayla and today we're going to be doing a newborn baby assessment on baby Alyssa. This is my mom and Mom, do you give me consent to record you today?
I do.
Okay, so we're going to get started. Before I come in, I'm going to gather my supplies and then I am going to come to the door. I'm going to knock. Hi, my name's Kayla. I'm going to be doing an assessment of your baby today, if that's okay.
Yes, ma'am.
Okay, so then I'll come in, I'll create patient privacy, and I'll do hand hygiene. Then I'm gonna ask Mom, what was the birth like of baby Alyssa?
It was wonderful.
Did you have a C-section or a vaginal birth?
I had a vaginal.
Okay. And then I'm also going to ask, how many pregnancies have you had and how many did you give birth to?
3 pregnancies, 3 births.
Okay. Now we're going to do baby's vital signs. So we're going to take our temperature and the axillary area. We want it to be between 97 and 99.7 degrees Fahrenheit. We're going to check baby's apical pulse when we're checking for pulse. And we're going to listen for 1 full minute. Then we're going to check baby's respiratory rate. To do this, we'll just stick our hand over her tummy and feel for how fast she's breathing. Also, if I didn't mention, baby's pulse should be between 120 and 160 beats per minute, and her respiration should be between 30 and 60 breaths per minute. And then we already said temperature. We're also at this point going to check baby's head circumference and chest circumference. So I'm going to record from right at her eyebrows and then also right at her nipples, go all the way around. I'm also going to check her length. For this, we'll start at the tip of her big toe up until her forehead. And then we'll also check her weight by just putting her on the scale. We're also going to note baby's general appearance. So we're going to look to see, is her body all aligned? Is everything symmetric? We're going to check some range of motion. And this is for checking basically muscle tone. We're going to check range of motion bilaterally. Make sure that everything is moving as it should. Everything's moving in unison. And then we're going to move on to the the skin. And we're also going to make note of baby's cry. If it's more animal-like, this could be a sign that she has some neurological damage, or her mom may or may not have been doing drugs or alcohol while baby was in the womb. So, for her skin, we're going to look for the vernix caseosa, which is going to be a milky, cheesy substance all over her skin. This is just protection for the baby when they come out of the uterus. We're going to be looking for petechiae. This is going to be like reddish purplish pinpoints all over baby's face, and this is usually from broken blood vessels right below the skin surface. It usually comes with birth, just passing the baby. We're going to look for Mongolian spots. These look like they could be bruises. They're like usually a bluish color and more brownish in black or darker toned babies. But this is also a normal finding. We're going to look for langua. Langua is hairs all over the baby's body, like as if she were a grown man, but it tends to fall off, so it's also completely normal. We're also going to look for the milia. Milia are calcium deposits that are going to be on the baby's chin, her nose, her forehead, or her cheeks. And then we're also going to look for erythema toxicum. This is essentially a rash or baby acne, and this is going to be, could be anywhere in her body, and this is usually from transferring from inside of the uterus into what we call earth, and just the difference in environment is what causes the inflammation and the rash. So then we're going to move on to baby's head. We want her head to be symmetric overall. We're gonna also assess her fontanelles. We want for them not to be sunken, and we don't want for them to be swollen. We don't want them to be sunken, and we don't want for them to be swollen. Her anterior fontanelle we want to be a diamond shape, and her posterior fontanelle we want to be a triangle shape. We're also going to look for any cephalohematoma. Cephalohematoma is a blood clot right below the scalp, right above the skull, and it's usually firm upon palpation. And then we're also looking for caput succodem. Caput succodem is the swelling of baby's scalp, and it's usually soft upon palpation. These are both normal findings. From the head, we're then going to move on to baby's eyes. So we want her eyes to be aligned and symmetric. We want them to be, her outer canthus to be in line with her outer ear. We want her eyes, her pupils to be equal, round, and reactive to light. We're going to take note of her eye color, her iris color, and we're also going to look at her conjunctiva. We want it to be pink and moist. And yeah, that's it for her eyes. We also want to look for any strabismus, which would be a lazy eye. This would not be a normal finding. Next, we're going to move on to her nose. We want to check for patency in both nostrils because babies are nose breathers, so they need that. We're also, for her ears, going to make sure, like we said, that they're aligned, but also that they're well formed, because any dimpling or malformation could be a sign of kidney damage. Then as we move on to baby's mouth, I'm going to go put on a glove. At this point, I'm going to palpate baby's soft palate and hard palate to make sure that these are both intact. We're also going to feel, we may find some Epstein pearls, which are, again, the calcium deposits in the mouth. And sometimes babies even have teeth. These are normal findings. While we're here, we also want to say baby's sucking and swallowing reflex are intact, which we usually measure when they're feeding because they're eating. And then that's really it for baby's mouth. Next, we're going to go to the neck and the clavicle. For the neck and the clavicle, we just want to make sure that it's still intact because birth can put a lot of pressure, and sometimes babies have broken bones. Then we're going to go to the chest. We already measured chest circumference, and we also measured the apical pulse. At this point, we're just listening for breath sounds. So if we hear fluid in the lungs, that's a normal finding up to 24 hours post-birth, because of the fluid-filled environment that baby used to be breathing in. And then we already did the apical pulse. We're also listening to her heart for any murmurs. Murmurs are also normal in the newborn baby because they are transforming from fetal circulation to neonatal circulation. And that is about it. We've already measured head and chest circumference. Alright, and then next we're going to be moving on to baby's abdomen. We want to make sure to look at the umbilical cord and make sure that we see 2 arteries and 1 vein. And then we also want to check her, listen to her bowel sounds. Okay, so this baby doesn't have any bowel sounds because she hasn't had her first feeding yet, but usually after her first feeding, we'll start to hear some bowel sounds. And we'll also check her voiding patterns. So if she's had her first feeding, at that point she'll pass what's called meconium, which is a black tarry stool, which is usually the baby's first stool that they pass. From there, we're going to actually turn baby over. So we're going to turn her over. We're going to feel her spine. We want to make sure there's no gaps or anything within her spine. And then we're also going to make sure everything is aligned. We'll also feel over the anus to make sure that it is not just a fissure, but that it's patent so that the baby can eliminate. And then we're going to move on to the baby's genitals. For the baby's genitals, since she's a baby girl, we're going to check to see if she has any discharge, and then we're also going to check to make sure that her labia majora covers her clitoris. If she was a male, we would check to see that she has rugae on her scrotum, that her testes have descended into the scrotum, and then also that his meatus is midline so that he can use the restroom. Next, we're going to go to baby's extremities. We want to make sure that she has all of her toes, all of her fingers. We want to make sure she has range of motion and that it's symmetrical. We want to check for muscle tone and strength. And then we also want to check for any hip dislocation or feet clubbing. So for hip dislocation, we do the Ortolani test. We'll put our fingers on the outer thigh and bend her knee to her stomach, and then we'll twist laterally to the side. And if we hear any popping sounds, that means that baby has a dislocated hip. And then feet clubbing would be also something that we would make note of. That's not a normal finding. So we've already checked muscle tone, symmetry. The next thing that we're going to move on to would be our reflexes. So for our reflexes, we've already checked sucking and swallowing. Next thing that we're going to check is our Moro reflex. For the Moro reflex, we're going to hold baby and act like we're going to drop baby. And her arms should go high in the sky. And then we're going to do her tonic neck reflex, where if we turn her head, her arm should be extended and then her opposite arm should be flexed. We're going to do our, we did tonic neck, we're going to do the palmar reflex. So I put my finger in baby's palm. She should grab my finger. And then if I put my finger on her toes, she should also grab my finger with her toes. And then we've already done sucking and swallowing. We'll do the stepping reflex, where we lift up one foot and baby should take another step as if she's trying to start walking. The rooting reflex would be if I rub my finger on baby's cheek, she'll start to bring her mouth towards me so that she's able to eat. That's like their reflex for being able to eat. And then we're going to do Babinski sign, where I'll rub my finger up and across her foot. And when I do that, she should basically spread all her toes out like this. And then the last reflex that we're going to do is the trunk incurvation reflex, where if I rub her side, she should turn into that side. The last thing that we would take note of is baby's behavioral state. And this is just going to basically signify how alert the baby is and also how active she is. Now, I believe that's it. Bye, guys.